Despite calls from the NDP, some Alberta doctors, and now one of the province's largest unions, the government says Alberta will not declare a healthcare emergency or reopen the legislature for an urgent debate.
Calling back the legislature and spending a bunch of money and bringing everybody back into there to talk about something we all agree has to be fixed. We all already have put the money in place to invest in, and we're seeing metrics that show that investment is working, is going to help at all. What we need to do is make sure that we follow through on our commitments.
The calls are coming after a public fatality inquiry was ordered into the death of a 44-year-old Edmonton father who waited almost 8 hours in an ER for treatment. This week, doctors also went public about 6 other deaths and 30 near misses as hospitals operate above 100% capacity. Government ministers have acknowledged significant pressure on the system, made worse by the flu, but insist their health care plans are the right ones.
The Premier is laser focused on making sure that this works. She's speaking to doctors constantly. She's speaking to all of her ministers that are working in the system, including myself, on a daily basis.
But the Canadian Union of Public Employees, which represents 40,000 Alberta workers, says our emergency rooms are crumbling into chaos. CUPE has launched stateofemergency.ca, where people can sign a petition to demand urgent action and express their frustrations with Alberta healthcare.
Declaring a state of emergency under Alberta's Public Health Act would allow the provincial government to temporarily, at least centralize authority and rapidly mobilize resources.
Part of the issue plaguing hospitals, says this former MLA, now ER doctor, is a lack of appropriate care for seniors.
We're at 110% capacity. Every hospital bed is full. 25% of those hospital beds are plugged up by fragile seniors who don't need to be there. They need to be in home care or long-term care.
But the assisted living minister says his government has recently reduced those numbers and is building 1,800 new senior spaces to free up more beds. He blames Alberta Health Services for not sooner using funding for that issue.
Age S did not increase capacity with that money. We don't know exactly what they use that money for. That's a conversation probably for a different minister. But the point is the investment was coming from multiple different governments and was not being spent. We recognize that, and when we took over, we started to make that investment, make sure it was going towards those continuing care spaces, which has resulted in significant reductions.
It's been almost 3 weeks since the Premier gave a press conference. She was on vacation and returned from out of the country on Monday. But Nixon says she is working incredibly hard, and Albertans will hear from her soon. Reporting from the legislature, Sean Amato, City News.